Globally, around 2.5 million babies die in the first month of life. 75% of them die within the first week, and about 6,700 newborn deaths occur every day worldwide. Hello, I'm Dr. Saroj, and welcome to this very important discussions on 10 danger signs in newborn. Your newborn baby is going through many changes in getting used to life in the outside world. Most babies grow and thrive well with no problems at all. But sometimes babies get sick and signs of illness may not be very obvious. There are certain warning signs you should watch for in a newborn, as any of these signs could indicate a serious health problem in your baby. So if you are a new parent or soon to be parent, this video is for you. So let's get started. Number 1. Refusal to feed and lethargy. It is the first and most important danger signs in newborn. Babies usually have a tendency to refuse to feed as soon as there is any issue regarding their health. Baby also sleeps a lot in the initial few days of life, and they usually only wake up in between for feeds. Once awake, they are alert and active. But if a baby is unusually tired, doesn't show much of the body movement, seems sleepy or drowsy all the time, and sucks very poorly or doesn't even suckle at all, it's worth paying attention to these signs, as it may indicate severe infection, dehydration, or a state of low blood sugar that can be fatal or at times lead to severe neurological damage. Number 2. Persistent crying. It's very natural for babies to cry, but when the crying is persistent or high-pitched, or if the newborn baby is crying for long periods despite they have been fed and comforted, it may be a sign of pain or discomfort and should not be ignored. Painful conditions like gas, colic, or ear infection could be the reason, but studies have found that inconceivable crying could be linked to infections such as urinary tract infections or even severe sepsis, which can be life-threatening. Number 3. Breathing difficulties. A neonate's breathing should generally be smooth and regular, and their chest rises and falls quietly. But if a baby is having trouble breathing, they may breathe very fast, or there may be flaring of nostrils, or a noisy breathing sound may be present in an attempt to keep air inside the lungs, known as grunting. Apart from this, babies may also have chest retractions, in which the muscles between and below the ribs pull inward, making the chest appear shrunken in. And if the baby is premature or very sick, they can have episodes of apnea as well, in which the baby stops breathing for 15 to 20 seconds and again continues breathing. All these signs could indicate severe respiratory distress that needs immediate medical attention and can be life-threatening if overlooked. Number 4. Jaundice. In jaundice, your baby's skin or sclera of their eyes turns yellow. It's a common condition observed in about 70 to 80% of the newborns between 3rd to 7th day of life, and usually is not a cause of concern. But if jaundice appears within first 24 hours of life, or it lasts longer than 2 weeks, it could be a sign of something very serious like liver dysfunction, blood group incompatibility between mother and child, or other red cell breakdown related issues. This should be checked by a doctor immediately to ensure timely interventions like phototherapy, and also to avoid complications, because neonatal jaundice, if not treated properly, can lead to severe brain damage, a condition known as kernicterus. Apart from yellow skin, if your child is passing white or clay colored stool or dark yellow urine, these might as well suggest the baby is jaundiced. So don't forget to check the color of stool and urine as well. Number 5. Cyanosis. This is another skin color change that may be dangerous to your newborn. In cyanosis, the skin becomes bluish. Although immediately after birth, newborns usually have bluish hands and feet, a condition known as acrocyanosis. It usually resolves within an hour or two, but persistent cyanosis, mostly around oral cavity, chest, may be dangerous as it indicates low level of oxygen in the blood and can be due to lungs or heart related issues. So if the baby seems blue, consult a pediatrician immediately. Number 6. Abnormal body temperature. An abnormal body temperature is a critical danger sign in newborn. High temperature manifesting as fever or an abnormally low body temperature leading to hypothermia both are dangerous for the neonates and should never be ignored. A baby's temperature should generally be around 98 to 99 degree Fahrenheit. A fever greater than 100 degree Fahrenheit or a baby who feels cold to touch, especially with signs of lethargy, poor feeding or breathing difficulties, can indicate serious health problems like sepsis. You can compare the baby's temperature with your own, and if the baby's belly and feet feels cold, immediately place the baby on mother's bare chest and cover with cloths. If the baby is still cold or lethargic, it is a sign your baby might be very sick. So consulting a doctor is a must. Number 7. Seizure or uncontrolled movements. Seizures in neonate are rare but serious. If your baby experiences any uncontrolled movements like twitching or jerking of limbs, it could indicate a neurological issue or can be a sign of infection like meningitis. However, seizures in newborn can manifest in very subtle ways such as eye rolling, staring, lip smacking, paddling movement of the limbs, or stiffening of the body, and often require immediate medical attention to determine the cause and prevent severe neurological damage. Number 8. Abdominal or gastrointestinal symptoms. The most common gastrointestinal symptoms include vomiting, abdominal distension, and diarrhea. Although newborn vomits small amount of milk during burping or immediately after feed, it is not much of a concern. But if the vomiting is forceful, occurs again and again, and if the color of the vomitus is yellow or greenish, it is a sign of impending sepsis and should immediately be evaluated. Neonates also pass small amount of stool as soon as they are fed, a condition known as gastrocolic reflex. It is completely normal and doesn't warrant any investigations. But if the baby passes watery stool in large volumes or stool is mixed with mucus or blood and the baby seems lethargic, the baby should immediately be rushed to the nearest medical center for proper evaluation and management. Number 9. Weight loss. Newborn babies usually lose about 10% of their birth weight in the first 7 to 10 days of life. The more premature a baby is, more is the weight loss. However, this is a normal process and can be seen in every newborn, and babies start to gain weight after this period. But if your child doesn't gain weight or even loses previously gained weight despite of adequate feeding, it is a concern to be addressed. Babies can have weight-related issues if they have problems related to lungs, congenital heart disease, or severe infections. So always keep a track of your baby's weight and immediately consult your pediatrician if any concern. Last but not the least, number 10. Umbilical infection. The umbilical stump in babies is a potential source of infection as it is directly exposed to external environment. So proper care of the umbilical stump is very important. It should gently be wiped with sterile gauze and water, and nothing should be applied to the stump. Parents usually tend to apply various creams or powder to the umbilical stump, and believe me, you are just exposing your child to new source of infection by doing so. Umbilical infection can be identified as moist stump with redness around the umbilical region. There may also be presence of blood or pus coming out of the stump as well. The child may become irritable, lethargic, or refuses to feed and can also develop fever. Umbilical sepsis can be fatal if not taken care of properly. So urgent medical consultation should be done if you notice such symptoms. If your baby shows any of these danger signs, don't hesitate to contact your pediatrician or go to the emergency room immediately. Quick intervention can make all the difference. And remember, your baby's health in your own hands. Stay connected for more informative videos. Thank you.